Hello dear friends, I am Dr. Priyankur Roy, consultant practicing here in Siliguri. I am practicing in Roy's Clinic and Multispeciality Hospital near Kanchenjunga Stadium in Siliguri. Today we are going to look at a very disheartening condition which is called recurrent pregnancy loss. Now, the situation is where the pregnancy happens but the lady is not able to continue with the pregnancy and there is a loss that happens probably at the beginning, at second or third month, or in some cases maybe at the 5th, 6th or the 7th month as well. I understand this is a situation where there is emotional, physical trauma, but we have definitely ways to overcome them. So for definition, if you look at recurrent pregnancy loss is loss of 2 or more pregnancies that happens in the lady's lifetime that can happen mostly consecutively. So it could be an abortion which can happen at 6 months, 8 months or 10 weeks, or it could happen in months, that is probably at 6th month or the 7th month as well. The causes are different. So if you look at a few causes, in the female, there could be any connective tissue disorder like systemic lupus erythematosus, which we call SLE. There could be APLA. There could be some uterine defects as well, which could be some anomalous uterine defects. And in certain situations, there could be other conditions where the embryo that is formed is genetically abnormal. For the male partner, there could be some defects in the sperm, there could be defects with the DNA fragmentation of the sperm, etc. And if there is a bad quality embryo, there are high chances that probably that will go for a pregnancy loss. We have various ways of overcoming them. First of all, if you look at, most importantly, remember, whenever you miss your cycles, please go to a doctor, or if you're feeling a little, you'll go to a doctor a little later, please start off with folic acid, which is a must, should be taken to prevent congenital abnormalities like neural tube defect, etc. Secondly, we can do a hysteroscopy, which is introducing a camera into the uterine cavity, where we look into the uterine cavity to look at any bit of anomalies in the uterine cavity, and based on that, we can take a call on what we need to do. Thirdly, there is a very important medicine called ecospirin, which is given as a blood thinner. It increases the blood flow to the baby, and that is something that we look forward to in cases of RPL and has given successful results. Fourth, we can give low molecular weight heparin, which is an injection that increases the blood flow again, and that helps in successful pregnancy outcomes. Many of my patients have experienced with low molecular weight heparin successful outcomes, and thus I suggest the same to you. And we can also give various immunoglobulins, etc., which also in certain cases acts as immunosuppressants and acts in successful pregnancy. I hope that you will definitely overcome RPL in case if you have one, and you will come out with a successful outcome and take home a baby. In case if you find any difficulty, I'm always there to help. You can come and meet me, take a second opinion at any point of time, and we can together help you in getting a successful baby outcome and take home baby for your successful parenthood for you and your husband. Thank you so much, and I hope this video will give you some tips and bits of how to overcome RPL and how to take forward a successful baby to your house. Thank you.